Hello, everybody. My name is Carl Rothschild. I've been a chiropractor for a long time. I started in 1978, so I've been doing this whole thing for a long time. And I was having pretty good results. I mean, chiropractic, I loved it. I was out there out here, I should say, in L.A. Originally, I'm from Brooklyn. That's why I said out there. And I was doing very well. And then someone in 1998 introduced me to light therapy. And my first inclination was, yeah, right, I'm going to shine a light. It's going to make a difference. It sounded pretty hokey to me. But you know what? It changed things for me. So what I would go to my patients and I'd say, I would say, what you got? And what I mean by that is they would come to my facility. They've been patients of mine already for a while. And I said, look, I got this new thing here. I don't know what it can do. Nobody knows what it can do. Back then, they didn't know. All we knew was one thing. It couldn't hurt. So this lady would go, hey, I got gum disease. And I said, I don't know. Let's try it. Boom, I healed her gum disease. This guy comes over to me and says, well, you help so much with my friend's shoulder with the lights. Could you help my kidneys? I said, I have no idea. I knew I couldn't bill for that. I knew I couldn't market it, but I was helping his kidneys. I helped things from head to toe. I got a guy came in on a Monday. No, I'm sorry. He forced me in on a Sunday. He had ripped his Achilles tendon. We lighted up his leg on that Sunday. I sent him to our orthopedist on Monday, and the orthopedist said, look, this guy needs surgery. And I said, yeah, he probably does. He ripped the damn thing. I said, but give me this week. And so we treated him Monday, Tuesday, Wednesday, Thursday, and on Friday he went to the orthopedist. In fact, on Wednesday we saw him twice. We went to the orthopedist on Friday, and they said he doesn't need surgery. In fact, in a month's time, I got his ripped Achilles tendon as good as his not ripped Achilles tendon. I am telling you, the lights changed my world. It revolutionized my practice. But then about 8 years ago, someone said, that ain't good enough, the fact that you can heal so many different things. I mean, bunions, every kind of foot problem. Well, you work your way from the bottom of the foot up to the top of the head. I was healing things that I could not believe. And then someone 8 years ago says, that's not good enough. Guess what? You can also shrink fat cells. I went, what? What do you mean? We can actually reduce fat in the individual. Now, I've been involved with weight loss from the day I started in practice and even before that. And I can tell you that it's not so easy. If you're a fathead like me and you like food, in order to stay trim, you have to, it has to take some discipline. But when you add lights to a person's life and then put them on an average easy diet, the results are spectacular. But I can tell you that it not only reduces fat, guess what? It also increases muscle. So it's not so much about losing weight because muscle weighs so much more than fat, that if we reduce fat and increase muscle, you're not going to see it on the scale, but they are going to see it in their clothes. They're going to fit in their clothing much better. And if they have any other ways, we actually include equipment that allows the person to measure their body fat percentage, and we'll see that go down. And like I said, 8 years ago, we discovered about fat reduction, and I said, okay, that's it. I'm going to start manufacturing these lights. And I did a lot of research. I worked with a team, and we came up with great equipment, always come up with what I consider the state-of-the-art equipment until this most recent equipment, which is called the Trifecta light. And this is the model that we just came out with. Again, we've been doing manufacturing for a long, long time. But this equipment has changed our lives, changed everybody. Now, the reason why we call it Trifecta is because of the triple effect of, so before I go there, the results were beyond our expectations. You put in, you figure, okay, we're going to increase this, we're going to make it more reliable, less likely to break, all these different things, but the results were beyond our expectations. So the reason why it's called Trifecta, again, is because it affects the face. I'm telling you, I'm going to show you some before and afters, that it will give the person what we call facial rejuvenation. I'm not allowed as a chiropractor to say I do a facelift, but it looks better than a facelift. So it's face, fat, as I told you, fat reduction, and we're going to heal things like you can't believe. And what we then also found out is it does great with cellulite. So you might call it the Trifecta Plus, face, fat, and healing, and let's throw in cellulite. And I'm going to show you some pictures. The cellulite's a slam dunk. It works great. The healing I already discussed with you, but it even goes beyond things you're not going to believe, the kind of things that we're healing. And then, of course, as I said, face and fat. So there I am. This was December, just this last December. And someone pointed out a picture of me. And I didn't even realize I was starting to, it was COVID. I was home. And I wasn't, the kids were home. My gyms were closed. Stressed out in my mind, having, I don't know if you can imagine, I'm a little bit older, but I had young kids at home 24/7. They weren't going to school. They would everything was here. It was like nuts. I'm giving you excuses of why I porked out. I couldn't believe it when I saw this picture. And I talked to Jim and I talked to Angela, and they told me about, their diet. And then, of course, I got on the lights, which I kind of was not doing religiously, when you have something for yourself. I got on the lights, I did a smart diet, and in 6 weeks, I lost the weight. And that's what your patients can have. And it might not always be 6 weeks, but I was not happy with the way I looked, and now I'm very happy. You notice that when you're fat, and again, I can use that, coin that phrase, when I'm fat, I have my shirt out, so it hides the fat. I decided I'm going to go into the tuck-in only from now on and stay nice and trim. At any rate, the thing is that the person's not only going to look better, but they're going to feel better. We're going to change things at the cellular level. And guess what? Underneath the whole thing, they're actually going to be better. I mean, I can't tell you how much better I felt. My flexibility, my fingers were getting a little stiff as you pork out. And now I was doing great. And I truly believe when I discovered these lights, especially the most recent equipment, that I've found the answers to my prayers. I mean, and I know it sounds a little over the top, so I apologize if I sound a little nutty, but that's how I feel. First of all, you've got effortless and healthy weight loss. All we need the person to do, we don't want them to go into starvation mode. They don't have to go into feeling deprived. Just go into what we call a calorically neutral diet. Stop with some of the, if they pig out every night, we're not going to have the same level of success. But if they just go into a calorically neutral diet and not feel deprived, we'll have great success with them. So I just want you to come closer, look closer at this image. Look at the skin. They call it orange peel skin. I mean, what did I know about aesthetics in the past as a chiropractor? I've learned a lot more. Now, this person, we saw them 2 to 3 times a week, 12 minutes a session, and it's 4 to 6 week program. By the way, a 12-minute session, we're talking about being able to see 3 to 4 people an hour. And so people are generating thousands of dollars a day extra in that one room with no extra effort. I'm going to show you how you don't even have to have extra staff in a moment. But come back closer, looking at the skin. They call it, as I said, orange peel. This lady was not happy with how she looked. She wasn't grossly fat, but she didn't like the skin. So the lights are so healing, it actually helps the skin. And the skin in all areas are going to look phenomenal. We're going to get rid of stretch marks. We're going to get rid of sagging skin. So in 6 weeks, boom. If they call this now porcelain skin, I mean, she was thrilled. Guess how many people she referred to the facility. And she didn't go through a deprivation diet. When you add a smart diet with the lights, results are spectacular. I talked to you about facelift. This is Maddie. She's a 72-year-old lady. She sent us these pictures, ecstatic. Look under the chin and jowl region. Look at the fine lines and wrinkles. So in 4 visits, I'm going to show you how we got rid of this, how the fine lines and wrinkles, and she sent us these pictures, and she's thrilled as heck. And yes, she referred the world to that facility. She's in Tennessee. Look at under the chin. Look at the face. And this was in 4 visits with a 72-year-old. The face is a slam dunk. Even if a lady or a person goes home and pigs out, the face is still going to respond. I'd rather they didn't. The face will still respond. So now let's talk about cellulite. Again, this will respond with or without their help. Look at this lady wasn't particularly very overweight. And this picture I'm going to show you is what we call an after. This took 1 month, 2 times a week. But I want you to look at this, and I know every one of you is going to say, that was Photoshopped. No, it wasn't. It wasn't. Look at that. And this is common. And they look beautiful. And this woman went from being embarrassed to not being embarrassed. And then in the world of natural healing, it's unbelievable how much fun we're having. And you know, the medical profession is really about drugs and surgery, so they really haven't hit the light therapy. But more and more people are going towards this. I mean, we've got famous people doing it. Any athlete, if they're before and or after an event, so let's talk about before. They use our equipment before the event. I promise you, they will respond. They will be much better at their event. But after an event, especially if there's any injury involved, they will feel phenomenal in a relatively short period of time. You know, I don't know if you know who Kevin Durant is. Here's you got this basketball player. He ripped his Achilles tendon. They didn't think it was that bad. He went into rehab for 1 month, never used our damn lights, went back to play in the finals. He was a basketball player on the Golden State Warriors just a few years ago, and he ripped it even worse. Now, they were talking about tens of millions of dollars that was lost because, maybe much more than that, because he couldn't play in the finals. That Golden State Warriors lost. He moved to Brooklyn, and the whole year he didn't play. If that guy had been on our equipment, I promise you, he would have been able to get back. We would have healed that Achilles tendon in record time, and it would have been stronger than his other Achilles tendon. So I can't show you ripped Achilles tendons. I can't show you shoulders, but this is a burn. Angela, who's going to be talking about with us in just a little while, I mean, look at this burn. This lady was told that she was going to have permanent scarring, that she was going to be in pain for months, and that it wouldn't heal for months by her wound center. Now she comes into the office. Angela puts the lights on her, and it was less than 2 weeks, it was gone. It was gone. Burns, cuts, wounds, post-surgically, the fact that our lights are not in every ER and OR is just because they're being stubborn and they want to do drugs and surgery. I am telling you, the healing with the lights are remarkable. So my staff just wrote down the most common conditions that people tell us about. I'm telling you, Lyme disease, if you have it in your region, it's a slam dunk. Kidney disease. Now, as a chiropractor, I can't advertise kidney. I can't charge for it, but it's just going to happen. So most people are not going to come into my office for their kidney disease, but it's going to happen. I'm going to cure their Lyme disease. I'm going to help them with, but the things within my license, carpal tunnel, bunions, rotator cuff. Now, if I go to a podiatrist, I say, we can heal bunions. You should work with us. The first question they ask, what do you think the first question they ask is it covered by insurance? I don't give a damn. Is it covered by insurance? You know it's covered by insurance as light therapy, unattended light therapy. What the hell? Or like a heat lamp. What do you think they pay for that? I don't even want to deal with insurance. Forget it. But the one thing, I'm telling you, the most popular thing, besides giving away money, if we advertise effortless healthy weight loss, that is the most popular thing, and we will drive lots of business into a facility. In fact, we include marketing in our program. We include the marketing, and we will drive tons of business to you. On top of that, the next most popular thing is peripheral neuropathy. So if somebody has neuropathy, if they're diabetic, for example, we do want to intervene and make sure that they stop, with the diabetes. We want to get their diabetes under control, but we stick them in our equipment, and I will tell you that most people, one session, and they will feel much, much better. They couldn't walk in comfortably, the tingling, the weird sensation down their leg, whatever it is, by the time after just one session. But certainly after 4 sessions, we reevaluate the person in the beginning of the 5th session. So we evaluate everybody on the first, before we start, on the first session, and then we reevaluate everybody on the beginning of the 5th. So we have 4 sessions with everybody, but we don't really need to emphasize the 4th session because most people just after the first session are feeling remarkably better. So as I said, I feel like I found the answers to my prayers. We talked about weight loss, facelift, natural healing. It's an all-cash business. I don't want you to use this with insurance. Insurance will cover a light therapy or they'll consider it a heat lamp. So what are they going to pay for that? And now the patient's saying, well, the insurance company said it was only worth $40. our people are not charging less than 100, and that's really low. We're recommending 150. Remember, I'm going to show you how there's no extra staff. There's no even contact. You don't have to worry about COVID. We'll go over that routine in just a moment. No attorneys. I mean, if you're doing personal injury, you know that you're working for this person and you're dealing with attorneys. And they are, now you may be in a state where it's no fault. I'm in California. I have to deal with attorneys. Their goal is to rip us off. That's what they do. So I don't deal with attorneys anymore. I don't do PI. It's easy. It's quick to administer. I'm going to show you the protocol. It's ridiculously easy. It does not require a health practitioner's license. I'll repeat this later, but watch carefully. The lights are considered by the FDA as ordinary light and are not even classified. They're as dangerous as a flashlight. So if you're not worried about shining a flashlight on a person's body, that's how dangerous our lights are. And that's why it does not require a health practitioner's license. So you can be in Hawaii enjoying it. Well, maybe you live in Hawaii. But if you don't live in Hawaii, you can be vacationing somewhere while your staff is handling the practice. And it can help a huge percentage of the adult population. In my career, I've had 15 practices, and I like to cast what I call a wide net. I could treat so many things. Who could I not help in the adult population with our lights? I mean, what person over, let's say, 30, probably even over 18, doesn't have something I can help them with? And so what should you look for in a light therapy system? So I just want to tell you, it should be made in the United States, which our equipment is. Now, there's a thing about lasers versus LEDs. Now, there was a time 8 years ago when I first got involved with manufacturing that the laser was more powerful than the LED. But in some states like California, a chiropractor couldn't use a laser for anything other than chiropractic, I'll use that in quotes, kind of stuff. You couldn't use lasers for acupuncture points. You couldn't use lasers for weight loss, for example. So we came out with LEDs, and I will admit that it wasn't as powerful, but we can cover the whole body with our LEDs, and you couldn't with the lasers. Well, this is no longer true. Not only can we cover the whole body, but our LEDs are unbelievably powerful and will blow a laser out of the water. So power is you should be looking for unbelievable power. And I'm going to show you in just a little while how powerful our device is. Now, dual wavelengths. There were devices out there. When I started in my career, it was near-infrared only, and then there was another company that came out with red light only. I can tell you that red light is great. Well, let me start. That near-infrared is great for healing, and it does almost nothing. It probably does nothing for weight loss, but it's great to heal. And again, it's not infrared. Like you hear people say, well, my patient wants to know how this compares with the infrared sauna that they're experiencing at the gym. Infrared, by default, people use the term infrared. You know what they mean? Far infrared. You know what far infrared is? A great way to get heat deep penetrating into the person's body. It's just heat. It's not what near infrared. You know what near infrared does? At the cellular level, it stimulates the mitochondria. It stimulates ATP production. It's unbelievable. Near infrared is my favorite wavelength, and it can make changes that will rock your world. Red light, we have found, doesn't do that much for healing. And there are companies out there that are red light only for healing. I said, are you crazy? But I'm not going to tell them. I don't want them to learn this. Don't tell them, by the way. Red light, however, that company that emphasized red light, you know what they found out 9 years ago? They're the ones that found out that the red light affected the fat cell. And so I tip my hat off to them. I thank them for this. But that's what red light does. It just shrinks the fat cell. So our device has dual wavelengths of both red and near-infrared. So we can shrink fat cells, some healing with the red, and then we could kick butt with the near-infrared. That's where the sagging skin gets handled, the stretch marks, the healing of every tissue from head to toe. And then finally, you want to get a lot of tissue coverage. Our device is going to tissue coverage is unbelievable. From the bottom of the foot to the top of the head, from the front, the back, and left and right, we're going to bathe that person in this unbelievable, wonderful ray of lights. So now why bed? I want to tell you something. I stayed away from beds for years. You know what? The original beds that came out, not that, within the last few years, they didn't work. Don't tell these guys, but they didn't work. And they cost a lot of money. And I kept telling people, look, beds are not going to work. Now, why weren't they able to work? Not only were they too expensive, but until recently, in order to get the kind of penetration of the lights that we would want, the lights would just get too hot. But as the world grows and as technology improves, we're now able to generate so much power with our latest lights that we're able to generate that power and not hurt the person. The lights were getting too hot for these other devices, so they had to tone it down, and they weren't getting any penetration. Our device is perfect. It's going to give the power that we need and not get too hot. But the demand kept growing, especially with COVID. Imagine, I'm going to show you with these steps here and the protocol that even with COVID, you can have no patient contact and not even need any extra staff. Well, as I said, the technology has improved dramatically. So we're able to generate a great deal of power without generating too much heat. So the Trifecta light bed is unbelievably powerful. I'm going to go over that in a moment. The patient realizes changes in just one session. Now, in the past, with all the other systems that I've been involved with, that I've seen from our competitors, a person gets off the devices, whatever they had, and they say, I think maybe. There's no doubt with our device, one session, they're going to know something's different. And it's not subtle. It's unbelievable. And it's addicting. I have people that want to go every day. If not, and they go, can I do this every day? Yes, you can do it every day. Can I do it for the whole day? No, you don't want to do it more than, it's about 15 minutes max on our device. And you're having immediate fat loss, immediate healing, the energy, the people are talking about energy level that is unbelievable. We've got people talking about libido, that's unbelievable, better moods, thinking clearer, tighter skin. I don't even know where to go with this. It's unbelievable. So there's no pads, there's no wires, there's no contact. So the pads, I love them. We have a system that we sell that has wires and pads, but people can't figure out how to keep the wires from crossing, from being yanked out of the thing, from the thing breaking. It's driving me nuts. And the bed avoids all that stuff. And I'll also say you something else. The wires, the pad systems, all of them out there, there's not that many, there's two others. The pad system in, let's say, 2 years' time are going to look worn, really worn. The bed in 10 years will still look, they could use the term pristine. It will look brand new. So here's the bed. And you'll see there's also a head-foot panel, and I'll explain that in just a little while. It's absolutely gorgeous. So, I have a video that's not going to play. So instead, I'm going to relay how the video goes. But here's the head-foot panel. What it means is that you turn the person, you put this on here, and now you're going to not only have lights, bathing them in total lights, but we also have the head panel, which is aiming the lights on the head. And I am telling you, results with this will help with hair restoration, but also every kind of head thing you can think of. I'm going to go over some conditions, but how about macular degeneration? We've actually helped people with macular degeneration, and it's not subtle. We had a 90-something-year-old. They almost lost sight completely in one eye, and they were losing sight in the other. And in a relatively short period of time, in the eye that was having some sight in it, the ophthalmologist said, this thing looks absolutely normal. And in the eye that was getting really bad, that was improving dramatically. But for the brain, for this head panel, we're seeing improvement on all kinds of stuff. And I'm not going to put it in writing, but dementia, Alzheimer's, we know migraines, we know all that stuff. If you think I'm excited. So here's what it looks like. The person's lying down. They are being bathed. Now, the canopy, which comes over them, is lifted so that our photographer can take pictures. Also, this person would be in a bikini. They wouldn't be wearing this much clothing even. And this is where it's closed. It's 2 inches above and 2 inches below. So like with the pads, we're right on the person. And for sure, that's why we had, in the past, had much better results with pads than anybody's beds. But now that we can overcome that 2-inch difference with the lights, with the unbelievable power, we don't even have to concern ourselves about whether we're going to get great results. The results are incredible. So we pull the canopy closed. If the person's claustrophobic, there's a head extension here that the person can actually have their head outside of the bed. I mean, we've handled every objection and every issue possible. So if the person can't get over it, there are two possibilities if they're claustrophobic. They can push on, and this is a pull-push, what you call hydraulic. So if the person pushes on this at the arm part here, they can, or we can pull it up. Wherever we push or pull it, it will stay. So if they're feeling a little uncomfortable because it's too close, they can just push it up. If they'd like to get the maximum benefits, they will pull it closer. But if they're really claustrophobic, we can have it where their head is outside of the system completely. This is the video that won't play. So instead, what I'm going to tell you is the 6 simple steps. Number 1, Judy, go into room 3. Number 2, Judy removes her outer clothing. We tell him, look, come in with your bikini underneath. A man also, they're going to have a bathing suit underneath. And we want as little skin as possible, but we do not treat women's breasts. So you know how you not treat a woman's breast? They're wearing a bikini top. And if there's any other body part that, and by the way, there are 3 kinds of people we don't treat. And you have to do the screening before they go on the bed. Number 1, are you pregnant? We do not treat pregnant women. Why not? Because there are things out there called attorneys. If that kid comes out wearing a mustache, they're going to look all over the neighborhood to see who to blame for it. And even though we know these lights could not hurt, in fact, it will heal any problem this woman has, it will not negatively affect the fetus at all. But I can't argue with they want to blame everybody. So you do not treat pregnant women. You do not treat women's breasts. And you do not treat a fragile individual. So if you have somebody who's going to have a catastrophic event, and you can tell, and we will go over that when we go through the training, how you can determine if you have an individual, and it's rare. I mean, we're talking about a 99-year-old person who's on their last leg. Don't put that person, don't treat that person. But that goes to chiropractic as well. I had a patient having a heart attack in our waiting room. And if I didn't have the kind of facility that I had, if we weren't a mill. We didn't just do everything for the same thing with everybody. We saw this person struggling. If I would have taken that guy, put him in room 1, without ever even going into room 1, and he had his heart attack in room 1, I would have had a problem. And so we immediately got 911 and got him over to the hospital. What I'm saying is things happen, right? Having nothing to do with our lights. The lights could not hurt anybody. If we tried, it's as dangerous as a flashlight. But, just screen the person to see if they're fragile. The assistant sets the timer. So now what happens is Judy scripts down. She's got her bikini underneath. She gets in the bed. Remember, that room doesn't have a mirror. We're not worried about her fixing her hair and her makeup afterwards. It's just get in the thing. Judy gets in the bed, pulls the canopy closed over them as close as they want. The chiropractic assistant now sets the timer, turns the power on, and then comes back in 12 minutes. There's no body contact. Judy gets dressed and leaves. That's it. Now the chiropractic assistant wipes down the bed and goes, next. That's it. It's as easy as possible. So at any rate, let's talk about how powerful, okay? In the specs, I told you it's made in the United States. The bed is 600 pounds. This is not a minor thing. This is significant. We include installation, white glove delivery, and installation. The bed, the capacity is 6'5" and 400 pounds. Overall dimensions is 81 inches long, and it's about 3.5 feet wide and just under 7 feet long. So it requires a room that's what I call a massage room. Now, because the bed can be right up against the wall, the width of the room doesn't have to be as wide as a massage room because we don't have to get on the back side. But as far as length is concerned, you'd want 10, 12 feet is my suggestion. So then the electrical requirements, this is going to require great electrical impulse of 220 volts and a 60 amp breaker. We include the breaker, and then you just give it to the electrician and make sure that you have the 220 volt. The sessions are about 12 minutes. The LED rating is 10 years, 100,000 hours. The number of LEDs is 3,200 LEDs. So, and the power of each LED is 3,000 milliwatts. To give you a perspective, our pad system, which is 4 and 5 times stronger than anything else out there, is about 150 milliwatts. The beds are slated at 3,000 milliwatts. If just a year ago you had had a bed with 3,000 milliwatts, where the way the technology was back then, the patient could not tolerate that. But now that we're able to generate this power without the heat, that's where you're always trying to do as much power without heat. So our bed is called a 9,600 watt bed. So to give you, again, some perspective, our bed is 5.8 million joules in a 10-minute session. Any other bed out there is in the 100,000 joules in a 10-minute session range. You see the difference? 100,000 versus 5.8 million. This is not a toy. The other devices are like toys. Now, also we talked about integrating red and near-infrared. The warranty, actually, they've upped it to 5 years. So how does it work? So the unique light that's emitted from this device, and this is about weight loss, it causes the fat cell membranes to temporarily alter the permeability of the fat cell wall. And this brief change allows some of the fat contents to seep out to where it can then be processed by the body. We don't kill. We don't remove fat cells. So when people come to you and say, well, how does this compare to cool sculpting, radiofrequency, ultrasound cavitation, and liposuction? You know what those things are? They're death. They're killing essential tissue. Someone out there named these cells fat cells, and they did a disservice. These fat cells are much more than just storage sacs for fat. They're involved with stem cell production. They're involved with other hormonal production. And they also, yes, store fats and other things as well, including toxins. So when we're done in a very relatively 2 or 3 week program, and our programs are longer than that, but within 3 weeks we have detoxified this person's body. And that's one of the reasons why their energy level is going to be unbelievable. So what happens to that fat? So after being released, the fat is broken down into its components and then taken to the liver by the lymphatic system. And here the contents are either used or quickly eliminated by the body. And are there any risks? I can just tell you there are none. It's considered a safe alternative to invasive procedures out there. The treatment is 100% non-invasive and does not cause any bruising or scarring or anything. So like, for example, with the thing that freezes fat, you're killing the fat cells, and then you're burdening the body, and the person is going to be frequently overwhelmed. It's also a very asymmetric thing. So the people who come into our facility who have had those freeze of fat, it looks weird. Our system is very symmetrical. The person will look great. Anyhow, and there's no risk. Do your patients have to follow a diet? I think yes. If they're going to be, they can expect better results. Let's put it that way. If they reduce their caloric intake somewhat and increase their water consumption to 8 to 10 glasses a day, meanwhile reducing alcohol and soda consumption. But at the end, you're going to have a session with Angela, and she's going to discuss with you a brilliant program called Vitamin Med. And that Vitamin Med program is really easy to do. Look, I'm a fatty. I know fat. I've worked with fat people. And I've dealt with my whole family. We've always had to deal with it. There's no one in my family that doesn't have to do it. They're not all fat. They have to deal with it. If you can make it easy and healthy and then also effective, that's what you're looking for, and that's what we're talking about here. Do your patients have to exercise? Yes. So each of your patient sessions should be followed by at least 10 minutes of exercise to stimulate circulation and help burn the fat that's been released. And that's why we include a whole body vibrational system with every purchase. By default, I don't give people an option. Oh, look, I really need to get it. It's included. Now, if you already have it and you don't need another one, that's fine. But I want to make sure that everyone doesn't let that person go home without having a 10-minute session on the whole body vibration. Why 10-minute? Why whole body vibration instead of like a treadmill or a bicycle? Because guess what? The vibration systems work actually better to move that gunk that we've just released out of the fat cells eventually to the liver for use or elimination. It actually does better than anything else. So it's mandatory. We do the lights, they get on the whole body vibration. They don't say, well, do I have to? Yes, you have to. So at any rate, if I'm telling you, if you're not currently offering this type of service in your practice, I believe personally that you're working at a distinct disadvantage. I could say it in a harsh way and say if a facility opens up near you that has this and you don't, there's no way you can compete. Our offices are busy. People say, well, what about COVID? I have a video. We've interviewed people while they've been doing this through and after COVID, and if you want to call this after COVID, I think it's going to be with us for a long time. But even after COVID and now, people need this more than ever. Our facilities are busier than ever. And, if you ask Angela, she can get you the video of how people are busier than ever, even through COVID. It will be a dramatic way of increasing your income. It's a new client machine. We will drive so much business to you, you're not going to believe it. But your current clients are going to want to rush to sign up for something like that. And we teach you how do you transition somebody who's there for whatever reason, let's say for neck pain, for,
Watching you.
The program is from 8 to 30 sessions, and Angela actually will include a coaching session where Angela teaches you how do you sell packages. The chiropractors are really good at this, but she'll help you do it even better. And the treatments take 12 minutes. As I said, you should be able to see 3 to 4 people an hour without a problem. So ideally, these people are coming in 2 to 3 times a week. So what's included? Well, it's the bed, white glove installation. So we actually, by default, include the installation at wherever you want it. Remember, this thing weighs 600 pounds. So we're not suggesting that we're going to put it at your doorstep and you put it in there. We'll include the installation, the whole body vibration device, the lymphatic massager. And so what you do is after we put the person on the whole body vibration, they go from lights, they go to whole body vibration. We hand them the lymphatic massager, and they will do the lymphatic massage over the areas that we've just emphasized. Now, we're treating them head to toe, but if they're belly or most women, it's the upper thighs, buttocks, and belly. Now, I used to say don't hand it to them, do it for them, but with COVID and everything, we're just handing it to them. And what I found is that that's even better because they can do it the whole time that they're on the whole body vibrational device, which is usually 10, it could be 20 minutes. The whole time they're on there, they're using the lymphatic massager over that area. We also include the body comp analyzer, and we include the marketing material, which is posters, pamphlets, business cards, referral cards, and some other stuff as well. We also include the waiting room book and the waiting room video, which we personalize for the office. We include the one-on-one training, which is the basic training, where I have a basic training crew, and then a follow-up is a one-on-one session with me. And that's the advanced training. And then there's the advanced coaching, and Angela is going to be talking to you guys about it. She's going to be doing the advanced coaching with each of you. And the feedback I get from her coaching, and she can show you some videos of people who have been coached by her. It's uniquely different than training, by the way. And the coaching she'll teach about selling, about organizing your office, and marketing. And then it also includes the Facebook marketing. We're going to flood your facility with business. I promise you. And we also include unlimited customer support. My company's motto is we go to work after you get our equipment, not trying to get you to buy the equipment. So what could be your return on investment? Think about it. We have a program where it's $199 down. It's $199 a month for your first year. And I am telling you, our facilities are generating a huge amount. I'm going to be interviewing a guy next week who's doing $250,000 a month in business with our lights. Now, he has more than one of our piece of equipment, and that's our goal. We want to get you so busy, you need to buy more of our equipment. So the average package that we sell is about $2,400. So the average monthly, and this is low. I like to promise less and deliver more. $10,000 to $20,000 is a slam dunk and very easy. And after 1 year of only paying $109 a month, are you kidding? Most of our facilities are paying off the device in 2 or 3 months. And we have a program with this leasing program where there's no penalty if you want to pay it off in advance.